Breast cancer is a cancer that forms in the cells of the breast. There are three main types of breast cancer: ductal carcinoma, lobular carcinoma, and inflammatory breast cancer. Ductal carcinoma is in the cells that line the ducts of the breast and is where most breast cancer begins. Lobular carcinoma begins in the cells that line the lobules of the breast. Inflammatory breast cancer affects the tissues within the breast and is the least common form of breast cancer. Understanding the anatomy of the breast is helpful in understanding how breast cancer works. The breast is made up of three main things: lobules, which are glands and which make up the female breast most entirely. They are also the milk-producing glands. Ducts, which are tiny tubes that carry milk from the lobules to the nipples. And then the stroma. The stroma is connective and fatty tissues that surround the lobules and the ducts. Cancer cells become cancerous for a few different reasons. A cell within the breast can become cancerous due to a mutation in the DNA. There are two types of mutations that can occur: oncogenes, which speed up the division of a cell, and tumor suppressors, which slow down the division of a cell or cause the cell death. When cells are either being formed when not needed or not dying when they should, then a buildup of cells occur. This buildup forms a mass of tissues commonly called a lump or a tumor. The tumor can be benign or malignant. Benign tumors are non-cancerous tumors. Malignant tumors are cancerous. Since cells from malignant tumors have the ability to invade nearby tissues, the cancerous cells within the breast tissue can spread to the lymph nodes. If cancer cells have spread to the lymph nodes, there is a higher chance that the cell could have also gotten into the bloodstream and spread, which, aka metastasized, to other sites in the body. Common organs that breast cancer can spread to are the lungs, the brain, the liver, or the bones. While all women are at risk for breast cancer, some have greater risks. The factors that put women at greater risk for breast cancer are unavoidable. Some unavoidable risks include family history, inherited genes such as the BRCA1 or the BRCA2. These genes are tumor suppressor genes that can be inherited from the mother or the father. Other unavoidable risks are menstruating at an early age, ethnicity, and aging. Some risks that are avoidable are alcoholism, obesity, taking hormones, and using oral contraceptives such as birth control. There isn't any way to guarantee that someone will not get breast cancer. However, things can be done to lower their risk of breast cancer. Some ways to minimize the risk of getting breast cancer for younger women is breastfeeding. According to McTiernan, women who breastfeed their babies for at least a year in total have a reduced risk of developing breast cancer. For some older women who have gone through menopause, avoid taking hormone replacement therapies. Hormone replacement therapies have been known to cause cancer. Women who are at a high risk for breast cancer, which include women with family history, women over 60, or women who have had a breast biopsy in the past, whether it was cancerous or not, can take estrogen blocking drugs to reduce their risk. Any woman who is at high risk of breast cancer should talk to a physician about the positives and negatives of taking estrogen blocking drugs. Some things that all women can do is maintaining a healthy lifestyle, which includes minimizing alcohol consumption, not smoking, staying physically active, and keeping weight within a normal range. Some signs and symptoms of breast cancer can appear in the way that the breast looks or in feelings. Some ways that change in the breast in appearance is a dimpling in the breast, an unexplained swelling, shrinking of the breast, change in the shape or size. The nipple turns slightly inward or introverted, and any scaling or redness on the breast. Some changes that you can feel are changes in the texture of the skin of the breast or enlargement of pores, can look kind of like an orange, nipple tenderness, or a lump on the breast or in the underarm area. Some other signs include discharge from the nipple when a woman is not breastfeeding, and abnormalities in lymph nodes. Sometimes breast cancer can spread to lymph nodes and cause a lump or swelling there, even before the original tumor in the breast tissue is large enough to be felt. There are many effects that breast cancer can have on a person battling it, not only physically but mentally as well. Some physical effects include nausea or extreme lack of appetite, sudden or unexplained weight loss, or extreme fatigue and lack of energy. Some mental effects that it can have on a person is anger, depression, extreme fear, and discomfort with their own body. Depending on the treatment that the person receives for the breast cancer, can have some long-term effects, which include fatigue, which is one of the most common side effects and can continue 6 to 12 months after a person has finished treatment. Pain can also be a effect that one continues to experience after treatment. Chemotherapy can injure nerves. Radiation may make the area that was where it was received more sensitive, and surgery can leave painful scarrings. Some facts about breast cancer, according to the American Cancer Society of 2015, is that 231,840 new cases of invasive breast cancer will be diagnosed in women in 2015. 62,570 new cases of breast cancer carcinoma and non-invasive has not invaded nearby tissues, including ductal carcinoma and SITU and lobular carcinoma and SITU. 40,290 women will die from breast cancer. 2,350 new cases of breast cancer will be diagnosed in men. 440 men will die from breast cancer. The 5-year relative survival rate for female invasive breast cancer patients has improved from 75% in the mid-70s to 90% today. The 5-year relative survival rate for women diagnosed with localized breast cancer, which is cancer that hasn't spread to lymph nodes or outside the breast, is 98.5%, and cancer that has spread to nearby lymph nodes or regional stage, or to distant lymph nodes or organ distant stage, the survival rate falls to 84% or 24%. There are more than 2.8 million breast cancer survivors in the U.S., including women still being treated and those who have completed treatment.